Frontotemporal dementia. So this is actually another sort of category of disorders. I think the way it's taught typically is you'll only learn one. You will kind of call it pick disease. That's not necessarily true. There's a bunch of different types. Pick disease is sort of one specific name for one specific type, but you can think of them all more or less the same for your purposes. So it's the most common cause of dementia in those younger than 60. So it's kind of the most common young, and that's the age range that you should think about it, right? So I would think about it in 50, 60-year-old. Earlier, I mentioned that dementia is not always memory, right? So these are changes in behavior, sometimes language, sometimes movement. Very often can just be behavior. These people can perform perfectly on memory testing. Pathologically, similar hyperphosphorylated tau, right? You're going to hear about tau. Tau kind of causes a bunch of different disorders. Those inclusions are called pick bodies in, again, certain types of disease. And then you'll also hear about this ubiquitinated TDP43. There are other pathologic features. I would know these two. And then to the imaging that I have on the right, I'll kind of tell you a little bit more about this imaging. This is a T2 MRI. And you can tell because the CSF is very bright. And you can see that there's more CSF up here at the front of the brain, in the frontal and temporal lobes, than there is here at the back of the brain, right? So you kind of have this really highlights the significant atrophy pattern. This person also has big ventricles, more so in the front than in the back. Basel, yes, we can see tau in Alzheimer's, we can see tau in pick disease, we can see tau in some Parkinsonism syndromes, we can see tau in a lot of different places. But for testing, don't let me mess you up, right? I would think about tau as Alzheimer's, frontotemporal dementia.